I'm very excited about this particular webinar. I think it's going to be really interesting. So as many of you know, well, I hope many of you know, Working Families is the work-life balance charity. And our mission is to remove the barriers that people with caring responsibilities face in the workplace. We work closely with employers, supporting them to create flexible, high-performing workplaces. And this week, as I hope you all know, we're celebrating National Work-Life Week, which is our annual campaign to get employers and employees talking about well-being at work and work-life fit. National Work-Life Week is more important than ever this year, as the world of work has transformed in the last 7 months, as we, all of us, only too painfully know. But employers have realised that many, many, many more jobs than previously thought can be done on a flexible basis. So we'd love you to tweet about this webinar. Please use the hashtag WorkLifeWeek and tag us at WorkingFamUK. And just to be clear, the webinar is being recorded and it will be shared on social media. So it's my delight today to welcome Clare Budden, who's the Group Chief Executive of ClwydAlyn, James Thompson, who's the Interim Assistant Director of the London Borough of Waltham Forest, and Garrett Martin, the Deputy Director of the Royal College of Nursing, Northern Ireland. So much has been spoken recently about how millions of employees have been adapting to working from home during the pandemic. But what about those employees who have place-based work, whose work can't be done from home? This panel discussion will focus on employers whose staff are on the front line, providing services directly to the public. We will hear about the challenges of implementing flexible and family-friendly policies for a workforce that cannot work from home, innovations that have come out of COVID-19, and what the future might hold for new ways of working. So welcome everybody, great to have you all join us, and I'm going to ask Clare to speak first. Thank you, Clare.
Thank you. Good afternoon, everybody. Pnawn da, great to be here. My organisation, ClwydAlyn, is a not-for-profit housing association based in North Wales. And we employ 750 people altogether in a range of different services. So we have about 150 office-based staff, and then we have about 150 staff who, pre-COVID, mainly work days, repairing homes, letting empty homes to people. And then we have about 450 staff who work in our homeless services and our care and nursing homes. So what you would call your kind of critical 24/7 frontline services. And as I think the whole kind of focus of this session talks to, it was quite easy really to introduce more flexibilities for our office-based staff working at home. We allowed them to develop team agreements, which just focused on outputs and outcomes. And we asked them to just deliver services to people in the way that worked best for them as a team, without setting down what time of the day that needed to be, what day of the week that needed to be, and who needed to do what. And that's had a fantastic impact inside the organisation in terms of building trust, but also actually making sure that in those critical 24/7 services, when they need to speak to a HR professional or they need to speak to an accountant, they might not always be working 9 to 5 anymore. So actually, some of the flexibilities in the back office have delivered much better services for some of those staff in remote buildings, delivering street homeless services who feel they can never access a colleague for help and advice other than between the kind of regular office hours. But we wanted to go much further than that and think about how could we have flexibilities for those staff that we were relying on so much and our residents were relying on so much. And we really just put the problem over to teams and said, have a look at working patterns, have a look at working arrangements, and as long as we deliver what we need to deliver for customers, you come up with the arrangements that are going to work best. So we don't have a single model, it's all been developed team by team. For our repair staff, those trades people who deliver essential works in people's homes, some of that's meant some people starting to work at the weekend so they could be at home more with the children and delivering their caring responsibilities, whether that was doing education or caring for an elderly relative during the week. Some people have asked just to work a longer day so they could get their hours done in a shorter time frame over the week, giving them more family time. But it's also provided some great benefits to tenants, because what it's meant is that you can sign up for your new property in an evening or at the weekend. You can get a repair done in the evening or the weekend. And as a tenant, you don't necessarily need to book half a day off work and sit and wait for the joiner to arrive. Perhaps moving on again, what was even more challenging for us was how we could introduce more flexibilities into our homeless services, our 24/7 services. Again, we made that team-led. And what we found, we've got 14 different homeless hostels. They don't all work in the same way. They've developed what works for them as a team. So people reviewed and changed their shift patterns. In some services now, people are doing 12-hour shifts because they felt that would put themselves at less risk if they were only going into work 3 times a week rather than 5. And it would also put residents at less risk. It's also meant that they're actually effectively working with people throughout the whole of the day, rather than residents needing to deal with shift changes of staff during the day. It's also meant that we could allow some of our staff who were shielding or who had childcare or elderly care responsibilities to work from home and do support planning over the phone or over the internet with people. And pre-COVID, we just said that was an impossible thing to do. How can you deliver a supported housing service unless you're in the same room as somebody? I can tell you that in our domestic violence refuge, we've actually found those people wanting to access advice around domestic violence have found that flexibility much better. We've had more engagement from people when they can do a FaceTime call or an internet call with a support worker to discuss their DV at the time that suits them. So that could be after the children have gone to bed, or that could be when the partner's out of the property. So we've had some really, really good successes. What it's built is it's built more loyalty to the organisation, it's built more trust, and it's built more flexibility. What we found already is that we've got significantly reduced sickness absence levels, because people are starting to be more honest about some of the challenges they face in their life. So your child's ill, what do you do? Do you phone in sick, or do you have an honest conversation which says, actually, I can't get into work today because I need to take my child somewhere? What we've found since we've introduced these flexibilities is that more people are actually just phoning up and being honest with us. And then we're finding that through the team agreements that each team's developed, another colleague's probably willing to cover a few hours for that person. And the person who needs the time away just offers to make those hours up. So we're finding that we can make savings in relief and agency cover in services where we need staff in to have the right ratios there. So I think what we know is we want to continue to build on this for the future. The area that we still need to do more work on is in our care and nursing portfolio, where they've got very, very traditional shift patterns. And of course, you need a certain ratio of nurses in to deliver the right level of care. So that's the area that we're going to look at next. But so far, so good. We can see through our staff engagement that we've got some really positive outcomes for people in what's been a really tricky and challenging time, particularly when you have no option but to go into work in what's been quite a scary environment for people at times. Thanks.
Claire, thank you. That was absolutely fascinating. I was really struck by the word that kept on coming out for me was teams and trust. And that I just think it's testament to actually this is how people want to work, yeah, and when it really works for them. And also that business about back office flexibility, really supporting frontline workers. Yeah. Absolutely, that must only be a good thing. Claire, thank you very much. So I'm now going to ask James Thompson to speak to us. And James, as I mentioned earlier, is the Interim Assistant Director for the London Borough of Waltham Forest. Thanks, James.
No problem, thank you. Okay, so good afternoon, everyone. So as I've just been introduced, I am the Interim Assistant Director for Waltham Forest. I work mainly with children's services. I do have some crossover into the adult world and working with some of the adult services as well. But I suppose for us, it was around when lockdown first came, it kind of affected everyone, and every team was very different in how it kind of affects us within the local authority. So some services we could do virtually and we could switch everything over onto our digital platforms, and others we couldn't. I suppose as we were trying to follow all the government guidelines, we sent everyone home. We made sure that there was a lot of flexibility in when we did that. So we enabled people to take work chairs work monitors, enabling them to set up a workspace within their home if they could. If they couldn't, we then obviously enabled them to have laptop desks or things that would enable it to make them feel a bit more comfortable when they was working from home. I suppose part of the difference we had to switch everything over into the digital kind of world, and for our staff that was quite good. A lot of our staff were quite computer literate, and we had made sure we could offer support to the staff who weren't as kind of computer literate and needed some support. We also realised that not only were our staff kind of working in those initial days of lockdown, they was also homeschooling, entertaining, having other care responsibilities, running around after family members who were chilled in and needed some support. So we had to try and work with our staff to offer that work-life balance. So the biggest thing we did was we offered them more flexible work patterns. We enabled staff to work on the weekend if they needed to, or to start later in the day, or start earlier in the morning, depending on kind of what other arrangements and what other conditions they had to kind of deal with. You know, we also offered the kind of the flexibility around working so in the evenings. We also as well had to consider the well-being of staff who might have started to feel isolated. So we tried to increase our online meetings with them as well, so we could have those discussions to try and again make them feel part of the team, make them feel part of kind of what we were trying to do in the community. I know as a team manager, I've worked in the MASH. We didn't necessarily visit, so the MASH is the front door for services coming into the local authority. So although they could all work from home, as it was all a kind of digital service, when lockdown started to change, we encouraged staff to perhaps come into the office and have a change of scenery, see something different, speak to some people. Again, wasn't kind of enforced, it was down to them, but it enabled that split between work life and kind of home life, because we know that obviously some of those social interactions outside of the home definitely helps with kind of our mental health and our well-being. I think as well, we as I said, the majority of our visits were virtual into the digital arena, so we use WhatsApp, FaceTime, Zoom, because we had to try and maintain contact with children as well during this period, and some of our most vulnerable children in society we was trying to still work with. Obviously, we soon realised that you couldn't necessarily complete a safeguarding inquiry or investigation online, or how do you discuss a child who's high risk of missing to do a return home interview over the phone? It's important there was some interactions face to face as well. And I suppose for us, there was quite a few number of considerations when it came to moving back to face-to-face work. In other words, were we following the current guidance? Were the workers and families safe and feeling safe when they went to families' homes? Did we have enough PPE? You know, how would families cope with a social worker attending their home if they felt they had to shield, but we knew there was someone vulnerable in that household we had to go and see? And then how do you conduct a socially distanced safeguarding inquiry? I mean, in many respects, the question today is you don't, you know, and you have to make sure that your staff feel safe, the young persons feel safe. I mean, it was also the balance, the competing needs of visits to young people. And, you know, when a social worker turns up on your front door with a face shield and a face mask, well, is that going to scare the young people? Is that going to make them think, well, who's this coming into our home? Where's this coming from? So there was lots of considerations to try and make sure that the work we did was balanced. But on the flip side, we saw it as a bit of an opportunity as a borough. We saw it as a way that we could kind of support and target our support to help to reach our hard to reach young people. So our young people who were at risk of child sex exploitation, our young people who were at high risk of missing. And there was a number of examples that allowed us to use that flexible working arrangements, but also get out and work with our young people. So some of those examples are our youth offending team. We made sure that they mobilised a team that was available 7 days a week, and it offered every child in their caseload a regular doorstep visit. So we could make sure they was keeping to their bail conditions, licence conditions, and was staying in when they should do and staying to their curfews. Our missing outreach team, they put all their efforts into engaging with the highest risk missing young people, because again, they was at home. They weren't going missing so much. So we could try and offer those strategies for some of these people and their families to make sure they didn't go missing longer term. We've also been having a bit of a gang strategy recently called Operation Deptford, where we've been going out with the police on the weekends and targeting local hotspots. Again, because we know our young people aren't travelling as much and aren't going out of Borough and going out of London because of the lockdown arrangements. I think as well, when we talk that, we have to look at kind of the education of our young people, and you know, our education of vulnerable young people, we made sure we facilitated that online. So we had online tutoring, not just for our vulnerable children, but also for our staff children. We offered that out across the whole staff workforce because it enabled them to obviously do their work while their young people were doing tutoring, because the level of response from different schools, I don't know, I'm sure for me, I've got 2 children at 2 different schools, and the level of response in relation to what they was offered during lockdown was vastly different. And I'm sure that was the same across the country. We also supplied laptops to households where there wasn't a laptop, and that was before kind of the government initiative to have vulnerable children to access it, because we know there was a lot of things online that our young people could do. And I think the most telling part for us within a local authority was the community spirit. You know, people from all walks of life were volunteering and offering their support to make sure that we could set up a full food parcel service that went to our vulnerable adults as well as our vulnerable young people. So it was a very interesting time because it enabled us to look at all that flexibility that works around our work patterns and our homework life. And I think, I know Claire kind of mentioned it, I think there was a high level of trust between staff because it, as she said, you know, and I think for us, it enabled that open and honest conversations around, well, what is going on at home for you? How can we support you? What can we put in place? How can we help you help us? And I think that was one of our key considerations that we kind of looked at and did when we was working with our workforce to make sure that they continued to run the service that was vital for some of our vulnerable young people and adults. So thank you.
James, thank you very much indeed. And although you did mention trust, the word that I picked out consistently from everything you were saying was support. You supported the teams with the equipment they needed. You supported the teams with any additional training they needed. You supported their families with additional tutoring. You supported them with their well-being issues. So that was the thing that came out of that for me. And again, you know, it's key workers, isn't it? It's people who are helping people that are so vital to our lives that we're supporting. Thank you very much indeed for that, James.
No problem.
And now I'm going to introduce everybody to Garrett Martin. Garrett is the Deputy Director for the Royal College of Nursing in Northern Ireland. Welcome from Northern Ireland, Garrett.
Thank you, and good afternoon, everybody. Yes, my name is Garrett Martin. I'm the Deputy Director for the Royal College of Nursing, substantially here in Northern Ireland, but I'm currently working from home with our UK colleagues in the Employment Relations Policy and Nursing team to support our membership on a national basis, in particularly response to the COVID pandemic. So I've been given the brief to very quickly speak, I suppose, in relation to the challenges of implementing flexible and family-friendly policies, and for those who can't work from home. And as you all would know, that the overwhelming majority of nursing staff can't carry out their work from home. So by way of background, the RCN represents a membership of over 450,000 nurses, midwives, healthcare assistants, nursing students. I'm a nurse myself. I'm very privileged and honoured to be a nurse. I went back to clinical practice to help in the initial surge in the COVID ED department here in Belfast. And I would like to say that the nursing has absolutely responded amazingly to the challenges presented. Nursing, as you would know, is a gendered profession. 89% of the nursing workforce is female, with over 40% under 40 and over a third are over 51. So to put that in context, I suppose that's around emphasising the caring responsibilities outside of work that nurses have with children, parents. So the complexities of family life to contend with, as well as obviously the pressures within the pandemic. Nurses provide care and services to the public, as you know, 24/7, 365 days a year. Nurses have always worked flexibly, always had shift patterns, sometimes rigid, sometimes not so rigid. But nurses work across a vast range of areas, as you can imagine: NHS, independent private sector, voluntary sector. NHS is one of the world's biggest employers with 1.5 million employers and our employees, with around a third of those nurses, midwives and healthcare assistants. So close to 500,000, there's 330,000 registered nurses. So what was done differently during the pandemic? Well, essentially, at the outset, nurses, as you know, being on the front line, and you'll all remember the images in the media in relation to nurses donned in full PPE in our intensive care units and in our acute wards. Nurses had to respond in terms of working differently, being redeployed, temporarily redeployed to new clinical areas. So areas that were deemed as non-essential. Many staff were redeployed to those areas, so it brought obviously additional stressors or stress to staff. It was an emergency response for many, and it meant a real change in where some people worked and the nature of their work. So there were additional hours, there were some unpaid hours, in that ensuring just to make sure that the work gets done. Overtime, annual leave was cancelled in many situations at the start of the pandemic. So that had massive impact, as you can imagine, on work-life and homework balance. So those nurses were moved, some voluntary, some not, to unfamiliar clinical environments, which there were lots of fear, apprehension and vulnerability. Work that could be done remotely was, so some nurses were able to move to home working, and if you look at some of the areas like outpatients, primary care, GP work, even mental health, where some of those duties that previously would have been seen as, you know, a place where you had to be, we're able to move some of that using technology to more home-based working, which is one of the I suppose positive things to have come out of some of the changes that have happened. As I say, nurses and nursing did rise to the challenge, but it was at a cost. There are many sacrifices that were made. It had a severe impact on nurses' home life, the risk of exposure and contracting COVID, the risk of spreading it. So there were lots of issues in relation to leave and how that COVID sick leave and how that was negotiated nationally with the NHS Staff Council. And that's another point that we'll probably speak about later in relation to the importance of that and the importance of partnership working around how we develop policies and practices that can help in terms of making flexible working a reality. So there were many nurses who had to isolate significant time away from their family in order to protect their family, but to protect the public. Stresses of working in unfamiliar clinical environments, as I said, clinical risks were high, and selflessly redeployed to areas that they were unfamiliar with. So one of the biggest, I suppose, issues was the pay protection and protection in relation to making sure that staff didn't suffer financial detriment as a result of either being off sick or having to isolate, because obviously they were being exposed to COVID in many different clinical areas. In terms of some of the long-term changes and way of working, it's difficult to say, but definitely it's clear that there will be some significant changes for nurses in the extreme previous roles that were always seen as frontline or clinical roles may no longer be that way. For example, clinics, outpatient sessions, mental health intervention even that would have previously been seen as frontline. Some of those practices will change, and that opens up many new possibilities in terms of flexibility for staff. If you take examples of some specialist nurses, for example, who part of their work plan will be clinical, but other parts of it will be work that they won't have face-to-face interface with patients. It may be clinical audit, it may be CPD, it can be other administrative work. So the flexibility built in rather than a traditional Monday to Friday role is now being looked at in more ways that I think would have previously been done if the pandemic hadn't happened. So there's some of the examples. I suppose there's lots more, but ways and patterns of working certainly impact on the ability to retain and recruit staff. We did have the publication of the People's Plan in July from NHS employers, which we welcome, which has a large section around flexibility and flexible working. And that's something that we hope for the future will be embedded in terms of the practice of employers, of nurses, not just in the NHS, but also in the wider independent sector.
Garrett, thank you so much for that. It is extraordinary, isn't it, to think about what you and your colleagues have gone through during this pandemic. You know, for me, it really brings it home that we are, as people, so dependent on the caring nature of so many of the people we come in contact with. And one of the things I've been struck with by all three of you is when you're talking about your frontline staff, you're talking about people who are doing the caring, people who are looking after children, looking after people in terms of their housing, and the homeless who don't have a house, and of course us and all of our health, Garrett. So thank you very much indeed. And for Garrett, I was again really struck by how that is playing out, but the fact that the College of Nursing is so supportive of nurses and so wanting to ensure that they're not losing out, that they are being supported, but recognising that this is a crisis. So that must be a very difficult line for the college to tread. Thanks very much for sharing that with us. So I'm now going to give you 3 questions, and I'm going to ask you to come in as you want to. I'll ask each question in turn. And of course, if our audience would like to ask questions, we've already had 1 question in chat, which we'll come to in a minute. But also, if our participants would like to use the Q&A, that's probably the best place to put the questions themselves. So the first question that I'm going to ask is, what has been the most successful change to the way your people have worked during the pandemic that will continue in a post-COVID world? And whichever one of you wants to come in first. Or thinking, shall I pick somebody?
I don't mind if you want, I'll come in.
Okay.
I think for us, it's working from home. I think, you know, in the past, there might have been this issue around what staff were doing when they was working from home, and it's having that flexibility to be able to be at home. And I think, you know, for us, that will then enable us potentially to make some form of savings around office spaces and what we use, and then invest that back into the work that we do. So yeah, I definitely think it will be more people will work from home, and there'll be less time for us to be spent in a traditional office space.
James, quickly, do you think that'll mean no office space, all home working?
No, I think for us, and in the nature of our business and what we do, we have to have office space to be able to meet with our clients and speak to our clients, and obviously we need a space or a base for our workers when they're in Borough, if they don't live in Borough. So they'll need some space, but it probably won't be as big as what we've currently got at the moment. Yeah, and I think that's kind of what we'll look to do in the future.
Okay, thanks, James.
Could I just come in? Yeah,
Garrett,
sorry.
yeah.
I suppose just to agree with James, I think the first point I would make is that it is possible to work from home. One of the things that has came very clearly is that things that would have been completely seen as, you know, not being able to be done from home are now, and even that's from, as I mentioned, some clinical therapeutic interventions as well that would have been seen that you have to be present to do those. That has now challenged that completely. But specifically from our perspective, one of the, I suppose, successes, albeit it took some time to get there, was how important health and safety is, and ensuring that it's really front and center in terms of the health and well-being of frontline workers. It took some time to get there, and we know we've seen in the media the issues around PPE and risk assessments and the impact, particularly in relation to being workers. We absolutely now have seen a much greater focus, and rightly so, in how we carry out risk assessments for frontline workers, and the importance then of how we support that, redeploy staff to areas of lower risk. All of that has really become so important to it in relation to supporting the health and well-being of our workforce.
Interesting. So health and safety is actually being seen as something that is supportive of workers and supportive of people, as opposed to, oh, isn't it annoying that they want to
Absolutely.
whatever. Yeah. Interesting, Garrett. Claire?
For me, I think it's a word that's right behind your head, which is the flexibilities. I think that's been the real game changer for us, is introducing more flexibility and allowing that to be team-led, not management-led, coming up with a system that we expect everybody to welcome and fall into. It's been placing our trust in people and allowing them to develop the flexibilities. And I think an important point for me is also not to see working from home as a panacea. Some staff have really struggled to work from home. The environment's not right, they miss people, and we run very much a people-based business. So we've got to give teams the flexibility really to get that right balance between being at home if they can, flexing their shift patterns and days of work, but also making the space for personal contact, because that matters as well to people.
Thank you. So question number 2 for you all is, have you seen higher levels of employee engagement overall during the past 6 months? And if you have, how are you planning to maintain it? Or if you've seen a drop, what is your strategy for addressing this? And James went first last time, so I'm going to go to Garrett this time.
Thanks. Well, I suppose the RCN as an organisation works in partnership across lots of different employers, as you can imagine, and engagement varies. What we've seen at a national level, and we do have a national structure in relation to NHS Staff Council, which is employers, NHS employers, and Department of Health, and obviously the trade unions who represent the membership, who are responsible for the terms and conditions and the agreements around policies that support all the different ways of working for NHS staff, and that has seen real positives in terms of the type of national guidance that has been issued in terms of an arena for nurses and other professionals, obviously, who work and all workers who work in the health service, to raise issues, to come to agreement in relation to how best to support staff in such trying times. So I suppose in terms of the engagement piece, that has been good. We haven't always got what we've wanted for our members, but I think it's fair to say that it has worked well in terms of raising issues, and that in terms of individual employers has certainly helped set the tone of how the staff have a voice, and certainly is something that we've seen locally, varying degrees of engagement compared to, I suppose, previously, some because of the nature of the work, being in a very, very difficult time. It's been very difficult for employers as well as the staff.
Yeah, interesting, isn't it? I always think it's actually quite useful to have different levels of engagement being transparent, because then you've got something to aim for, I guess. Yeah. And Claire, for you, higher levels of employee engagement overall in the past 6 months?
Oh, tremendously high levels of engagement. Some things that have really humbled me and made me so proud. So in some of our services, we've needed additional staff over and above the usual rotas because cleaning regimes have been enhanced considerably in some of our homeless services where we couldn't provide social distancing, for example. And we've needed to feed people in our care homes in their apartments rather than them using the restaurant. So need for lots of extra staff at lunchtimes, that type of thing. And we had an apprentice joiner volunteering to be a housekeeper in a care home, a plasterer delivering lunches in an extra care service for months on end. Our learning and development manager, who's normally doing face-to-face training, volunteered to be a cleaner in our homeless services. We had lots of staff doing food deliveries to support local councils or delivering wellbeing packs or gardening packs. So the level of engagement was tremendous. And what we've learned from that is there's quite a lot of staff now who are looking over the hedge or the fence at maybe a different career choice, a different job within our organisation, because they've got to try something that normally we wouldn't ever have let them or given them the opportunity to do. So we're now developing all of our career pathways to just be more open with everybody about how it is possible to move to different parts of the organisation, to take on different roles. And I think there was a mass rush at the start of needing to do some very quick training for people about some of the services that they were going into, maybe things that they wouldn't normally have needed to be aware of. It could have been health and safety, could have been safeguarding, could have been a whole host of things. Actually now we're getting all of that training on our learning platform, so staff can access it at any time in their own time. So we've got people more geared up with some of the basic skills so that we can meet their aspirations, but also we've got them available should we need them in a particular service. So yeah, lots of learning, but really positive stuff in terms of what we can do for career development into the future.
Yeah, fascinating. Thanks, Claire. James?
I think it's quite similar. It's been varied. I think because of perhaps the flexibility we're offering to staff, well, then those levels of trust increase, and it enables that work to kind of take place. I think, you know, as I said before, and I said in my talk, I think there's a lot of suspicions around people working from home, whether it be overtly or covertly, and well, what are they really doing? And senior managers need to get on board with that. And I think our senior managers in our organisation are on board with that now. It's like, well, actually, 90% of our business can go online, and therefore it opens up that trust, and then it enables that engagement. You know, it's very similar. We've had people being redeployed across the council in services where we've had to shut down or kind of put on hold a bit so that frontline services could be supported. And again, I think that's been quite an eye-opener, because it means people have done different jobs and different roles, and it's helped them to kind of engage. And I think that's helped build that trust up as well.
Yeah, it's trust, isn't it? It's trust again, and what it brings. So our last question is, with employees carrying out such a huge range of roles with different restrictions in terms of flexible working, how do you endeavour to ensure consistency of approach to requests for flexible working? And this ties in with a question that's on our chat, on our Q&A, which is, how do you ensure that you don't create a them and us culture among staff, where certain groups feel as if they're being treated differently in terms of flexible working due to their frontline roles? Any further tips for how you will tackle this in the months ahead? It's about that consistency of approach. I'm going to go to Claire first this time.
This is the hardest question, isn't it? And I think I've probably got two different answers to it. I think you have to be honest that you can't actually be totally consistent in every type of job role, in every service, just because of the nature of what you're providing for people. But if somebody's circumstances change so much that they're unable to continue to do what they were doing in the way that they were doing it in their particular job role, then for me, it's the flexibility about looking at what else they could do for us within the organisation. We never want to lose good people. So is there something different they could do? And that might be it might be a short-term blip in their life, a short-term challenge, or it might be a medium or long-term thing. So we encourage all of our managers to look at how we can support staff's needs to work more flexibly, or to do different patterns, or do different things. We expect people to have an open and honest conversation about that, but recognising that there could be some times where it's not possible to meet people's needs. But we are a big organisation with a range of different jobs and duties. Let's have a chat if there's something else that might work better for you. So that's sort of how we'd approach it.
Okay. Honesty, transparency. And James next.
I mean, I kind of echo very much what Claire's kind of said. I think you can't have a one kind of way fits all in relation to flexible working. I think you have to kind of consider them all on their own merits. And whatever the needs of the service are as well, make sure that your service isn't being kind of run to a detriment because of everyone only wants to work in the morning, or everyone wants to work at the beginning of the week. You know, there has to be some flexibility from the workers as well to make sure that you're covering the core hours and the core business. In relation to kind of an us and them, I think unfortunately that's going to exist in most organisations, but it's how you recognise it and manage it. And that's the hard part when it comes to an us and them kind of scenario. There's always going to be otherness and us and them kind of being put out there with any organisation you work within.
And how do you manage that?
I think you have to recognise it. You have to take it on board and realise that there is this slight division between managers and workers, or clients and workers, and it's how you kind of bring that gap a bit closer together. And the first step is recognising it. It is at least acknowledging, recognising and saying, yeah, that may be you're not happy because so-and-so's allowed to do 4 days a week at home, but we'll try and work with you to make it work a bit better for you. You know, so I think it's recognising and acknowledging and almost having that open and honest discussion about it, so people are aware of it, because I think awareness clears up a lot of some of the problems that you get.
Okay. Thanks, James. Garrett?
Yeah, certainly from the RSN perspective, we certainly want to see the prioritising flexible working, and that it's not just for managers. we have a real opportunity here. I think we see an opportunity that we haven't had before. And I mentioned earlier about the NHS People Plan that was published in July, the end of July. And that has a very good section in relation to flexible working and the responsibilities of everyone in that, and very clearly sets out, you know, some very good principles around that in terms of flexibility by default, that's the starting position, that people have a right to work flexibly, trying to normalize the conversations about flexible working so that it isn't a surprise if somebody says, I have caring responsibilities and I need to do my work, be able to do my work differently, that there's role modeling from the top, so that managers, for example, who have flexible working arrangements, but others not just get the opportunity, but can role model it. Certainly in nursing and in roles, clinical roles where there's 24/7, 365 cover required, e-rostering has been in place for many years, but it's how we use that in a way that builds in the principles of flexible working. So we will certainly be working very, very closely with management and ensuring management's support flexible working, and particularly for those with caring responsibilities. And as I say, I represent the profession, female primarily, or predominantly female, and those people have other family and caring responsibilities where there's a real need to build in that. So we will certainly be holding employers to account in relation to the aspirations within the people plan, because if it's not achieved, we won't have a workforce fit for the future. You know, the NHS has lost 50,000-60,000 people in terms of its ability to retain staff, and a big part of that has to do with the lack of ability to work flexibly. So in order to retain staff, it's not something that we have, you know, as an option. We have to do this. So this is something that certainly over the coming months and years will be front and center of the workforce planning.
Yeah, I was really struck when you started, Garrett, and you were sharing some stats of that business, that 40% of the workforce are under 40 and 33% of the workforce are over 55. You know, it just starkly tells you that there's an issue there. So one of the other questions was, what's the best way of engaging staff within an organisation, and we're thinking particularly line managers here, to change the way that frontline staff are viewed and managed? And I guess that COVID will have had an impact here, because there'll be an increased appreciation of cleaners, you know, people who are really doing the key worker roles within our organisation, within our society. Anybody want to answer that one? Claire?
I think the question was perhaps, I understood the question to be about the challenge that managers might have about understanding whether their teams are getting the job done when people are working much more flexibly. And I think it's just a journey that you have to go on, and you have to keep talking with team leaders and managers about outputs and outcomes, rather than the time of day people are working and whether you can check if they've logged onto the system at X or Y time today. But that is a culture change. And I suppose if there's one thing we can thank the pandemic for, is that it's probably accelerated that rollout of that way of working. And it's in some organisations, managers have had to get used to it, whereas there may have been a resistance to it. And I think what most people have found is, funnily enough, most people want to do a good job. Most people want to feel proud about what they've achieved each day. And most people, if they feel they're trusted, will give back more, not less. And if you've got one or two people who don't, then they're not right for you and your organisation, are they? And you just deal with that. But I think it's about developing things that work in the interest of most people, and most people are reliable and do a good job for you. So I think it's just encouraging managers and team leaders and people to go with it. And when you get, and everybody gets it, that little thing inside that goes, how come they haven't responded to an email at 2 p.m, or how come they're not answering their phone? It's having a little chat with yourself that says, probably going to pick the kids up from school, that's fine, they'll probably be working at 7 tonight. And I think you've just got to keep doing that really too.
Yeah, Absolutely, Claire. Do Garrett or James want to comment on that one?
Yeah, I suppose that for me, it's back to challenging that culture that work is somewhere you go rather than something you do. And you know, there has been a bit of a culture around that, isn't there? And certainly there will always be roles, let's face it, that can't be done remotely. But there are parts of roles that can. And it's increasing that flexibility that will have benefits, and convincing everyone that there's benefits, because sometimes workers themselves don't necessarily want to work from home. You know, I've heard a good expression earlier on about feeling that from working, because they're forced to work from home, that they feel like they live at work rather than work from home. And I thought that was interesting in terms of, you know, that socialization piece. But I do think that it's just having that openness, having the conversation, seeing what will work. Of course, work needs to be done, but it can be done very differently and can be done flexibly. And opening those conversations with managers more and more is something that we need to continue to do.
James, do you want to add anything to that?
Yeah, I just think, again, it comes back to trust, doesn't it? It comes back to trust with managers and how managers trust their workers. And you're right, at 2:30, most of our workforce go off to go and pick up their kids. You know, we know that. That's what happens in that half-hour period. But as has been said, we know they'll be on till 6 or 7 in the evening. You know, so it's having that level of trust, and it does come back to you. And I think, but it's got to be from the top down and even from the bottom up. You know, it's got to work both ways. So our managers need to be saying, well, actually, that's fine for you to do that. You know, and it's been said, you know, for us that we work in a very much a stat-based business anyway, so we'll know if people aren't doing the core businesses, and it's not to kind of, you know, name and shame them, but to have that discussion and say, well, what's going on for you? Is it particularly difficult because you're shielding? Is it particularly difficult because you've got more care responsibilities? What's happening? And trying to work out a way that whether it offers more flexibility or more time for them to be able to do the businesses and the core business that we expect them to do. So yeah, I think it comes down to trust a lot.
And this is a question that I find very interesting. We've been talking exclusively about employees here and workers, but one of the questions in our Q&A is, how are your service users coping with the move to remote services? Historically, we've always assumed that people will prefer face-to-face contact. Has that been borne out by your experiences? And have you addressed or mitigated that? And I know you've all got slightly different answers to this question. So James, Children's Services, how has that been for your service users?
It's been varied. I mean, some don't want to see us because of some of the reasons why we're visiting, but you know, it's enabled us to get there a bit quicker in some respects, because we can do stuff online as well. We can do, well, that's not physically face-to-face. It's face-to-face on the computer screen, or it's face-to-face on a WhatsApp, or, you know, as I said, we have been increasing more face-to-face visits, and and I suppose, you know, our clients quite enjoy that depending on why we're going. So I think it's been very varied depending on the reasons for our visit. Let's put it that way. So yeah, I think people enjoy it, but I think some people are more than happy to talk to us on the phone as well.
Garrett and Claire?
Yeah, it's interesting, I suppose, from our perspective, from nursing perspective, some of this has come to light, and people are having to self-isolate and work from home because of a COVID-related issue, be it sickness or particularly, I suppose, self-isolation, where that readjustment in terms of other duties, and there's plenty of work there, I suppose, is that people can find work in the health service in relation to taking on other duties. It hasn't been as easy maybe as it could be. So I suppose for the future, it's looking at how that capacity and what work can be done at home, that could, in situations where people either need to work at home, that some of their duties are changed, but can also contribute to whatever the business might be, but in a way that isn't necessarily frontline, but can still be redeployed to do other duties that's meaningful. And sorry.
Yes. Garrett, you mentioned earlier that some of your services had moved online. How have your service users coped with that move to online services?
Yeah, it's interesting. I think one of the main areas obviously would be primary care and GP contacts and outpatient contacts. And there's once again mixed feedback that I have heard in relation to that. I don't have any empirical evidence as such, but you do hear of some patients who like it because they don't have to travel into an outpatient appointment. They can get that done through a video conference or through a telephone call. Others who are absolutely not, who don't like it, who are having great difficulty getting to see their GP face-to-face or their practice nurse. More so GP services, nurses in fairness, have continued to have, for the most part, face-to-face contact with patients, and we do know that we still don't know the outcome in terms of the real impact of the other non-COVID work and how access to services has truly been impacted on. There's no doubt about it, it has been, and waiting lists are obviously getting greater, but some patients, in fairness, have been reporting that they like the fact that they are able to use the technology in a way that, you know, they don't have to travel long distance, for example, for a 2-minute consultation with a consultant.
Thank you. Claire, your service users?
Again, it's a mixed picture, really. I think some things people have, we've introduced a lot of technology into our care and nursing homes, so residents can talk to family members over video calls and all that type of thing, and that's been quite nice to introduce that modern method of communication. But we've been doing thousands of wellbeing calls to people just to see how they are, and we know that a lot of people their mental health has been really negatively impacted by COVID, particularly people who live alone. So they're desperate for more face-to-face services to be able to be delivered and just to be able to see people. You know, even though you might deliver someone shopping, leaving it on the front steps different than going in and having a cup of tea with somebody for 10 minutes. So we found a mixed bag with our tenants and residents, really. And we've also found increasing levels of antisocial behaviour on our estates, and whether that's because more people are spending more time at home together and finding that quite difficult, whether it's connected to some of the people starting to lose their jobs who have no longer got, you know, a day filled with purpose. So a mixed bag, really. And I think it will mean we will deliver some things online in the future that we weren't doing in the past. And some people are liking to self-serve, but we've also got some statutory things where we just have to get into people's homes, for example, as well. So I think it will roll out some of the flexibilities around using modern ways of engaging with people, but we won't lose the personal contact altogether because it's really important to people.
Yeah, for me, I asked you earlier on, do you think everybody will be home working all the time? And I can't imagine that's going to be the case, because I think so few people some people will want to be doing that, but certainly not everybody. So it's all about looking at us all as individual people. So we've got one particular question for Garrett about whether or not there's a sense of people's good nature coming to an end, the willingness to sacrifice, particularly in Northern Ireland, where it's getting tougher again. And then a general question about communication from the top. How has that been going within your organisations? So Garrett, if we can go to you quickly first for how is it in Northern Ireland?
Well, in Northern Ireland, probably isn't any different than anywhere else. Our first wave in the pandemic probably wasn't as severe as in some parts of England, but we definitely have a weary workforce, who are frightened, who are tired. Yes, in some ways, I'm not saying that, I wouldn't necessarily say that goodwill has been lost, but it's certainly been stretched. It definitely is important to make sure that the workforce are supported and that they feel valued. And whilst, you know, the recognition in terms of the clapping and all of those things were important in terms of boosting morale, you know, we still see a lot of nurses and healthcare assistants and other healthcare workers who truly feel that their work isn't valued. And I think one of the things that come out of this is that nursing is so much more than just care and compassion. It's a graduate profession of critical thinking, highly educated professionals who have a real impact on safety, on patients' ability to recover, all those areas that I think in terms of being valued And the government does need to step up in terms of showing that pay, terms and conditions and how they're supported in relation to things like flexible working are so important in sending that message that they're valued. It's that piece though at the moment in terms of we're not out of the woods by any stretch at the moment. That's very, very difficult at the moment, to be honest. Yeah.
Thank you, Garrett. Claire and James, communication from the top, how's that been going? Claire, and then James.
Sorry, wasn't sure what order we were speaking in. We've been doing our best, you know, and I would never say you get this perfect, do you? But, you know, a mixture of face-to-face meetings with managers and team leaders, different levels of working groups so that we engagement. We don't have union reps, we have a staff forum, engaging with those regularly. I do little video things. I hate having them done, but people quite like sometimes, don't they, to watch a film rather than read a newsletter. We've done staff engagement surveys throughout the pandemic to get feedback from staff as well and from our tenants and residents. So I wouldn't say we've done anything that's rocket science. We've been doing all the basic stuff, trying to do it well, thanking people when they do a good job. Our staff newsletter each week always has photos in and positive pictures of nice things that are going on in schemes that show how really well our staff are working. So we've just been doing what we can as well as we can, but I'm sure there's learning from other places that can help us to how we continue to keep that momentum as we kind of keep grinding our way through this now.
And James, very quickly.
Yeah, I think communication has increased. I think, you know, I've been in more meetings with my chief exec in recent months than I have in recent years. I think because there's a push to make sure everyone's communicating, there's a push to make sure that we're being told what's going on because of the ever-changing, shall we say, issues around kind of government guidance and what's happening. We need to make sure that we know as an authority what we can and can't do. So, you know, there's now weekly kind of updates from the chief exec. You know, I know all team managers are now speaking to their staff team on a weekly basis. Obviously, before it might have been a 5-minute daily quick catch-up, but this way, everyone's in one place a lot more regularly and allows that kind of regular check-in. So I think it's got a lot better. It's improved a lot during this pandemic.
Oh, that's really interesting. It's really interesting to hear. So I am going to start wrapping things up now, unless Garrett wants to say anything particular about communication. No, you're fine on that one. It's been absolutely fascinating. I have loved hearing from you. And for me, the thing that keeps on coming up is trust, support and value. You know, if people are valued and trusted and supported to do their work, it is extraordinary what everybody could do. I love what Claire said, you know, oh, look, it's a surprise. People actually do want to do a good job of work. They do like most of the time going to work and being trusted to deliver. It's been absolutely fascinating talking to you today, and I'm sure that our participants would agree. So thank you all hugely. It's been absolutely brilliant. And for everybody who's watching, to keep the conversation going, share how your organisations are marking National Work-Life Week using the hashtag #WorkLifeWeek. Make sure to visit our website to learn more about our membership packages, our policy reviews, our virtual consultancy, and our training, which helps employers build a flexible culture. And of course, you know, all of this learning from Claire and from Garrett and from James, who suddenly looks like he's got a bit of sunshine in East London. So thank you all very much indeed. Goodbye, everybody. It's been absolutely wonderful. Thank you.